Stroke is an emergency. Act fast. It is estimated that 780,000 strokes occur in the United States annually. Also, stroke is the third leading cause of death and a leading cause of disability. The longer a stroke goes untreated, the greater the chance of permanent neurologic damage. Rapid intervention is crucial in the treatment of stroke. Two types of strokes exist: ischemic strokes and hemorrhagic strokes. About 80% of strokes are ischemic strokes. This type happens when a blood vessel in the brain develops a clot that cuts off blood flow to cells. Hemorrhagic strokes are the remaining 20% of strokes. They happen when a weakened blood vessel in the brain bursts. When the vessel bleeds or hemorrhages suddenly, surrounding brain tissue can become damaged. Hemorrhagic stroke is the most serious type of stroke.
Risk factors. First is high blood pressure. It is the leading risk factor for stroke. Adults should strive to keep their blood pressure below 140/90 or 130/80 if they are at higher risk for stroke. An ideal reading, however, is 120/80 or lower. Heart disease. Coronary heart disease, heart failure, or an enlarged heart and other heart diseases place people at a higher stroke risk. Third is high cholesterol. Excess cholesterol raises one's chances of heart disease and atherosclerosis. High cholesterol contributes to plaque buildup in arteries, which can block blood flow to the brain and cause a stroke. Smoking or tobacco lowers oxygen levels in the blood, forcing the heart to work harder and enabling blood clots to form more readily. According to the National Stroke Association, smokers have twice the risk of stroke as non-smokers. Diabetes. People with diabetes face higher risk of stroke because they often have other health problems and stroke risk factors, including high blood pressure, high cholesterol, and heart disease. Last, but certainly not least, is overweight or obesity. Extra weight, along with being sedentary, raises the chances of high blood pressure or diabetes.
There are 5 common signs and symptoms of stroke. They include sudden headache, sudden weakness, sudden dizziness, sudden vision trouble, as well as sudden speech trouble. Sudden headache may be accompanied by vomiting and altered consciousness. Weakness may include numbness or paralysis in the face, arm, or leg, especially on one side of the body. Dizziness may lead to sudden falls. Types of vision trouble include blurred vision, blackened vision in one or both eyes, or even double vision. An individual experiencing speech trouble may also experience confusion, slurred speech, and have difficulty understanding speech. If you notice one or more of these signs, don't wait, call 911.
Are you having a stroke? Act fast. Think fast and do the following. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward, or is one arm unable to raise up? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? And time. If you observe any of these signs, call 911 immediately. Every minute counts.
1.
Man, I cannot believe I wrote the spring ligament. I know that the deltoid ligament is the only ligament that attaches on the medial side of the ankle to the talus, sustaentalicum, tali, and navicular. And on top of that, I have a major headache.
Hi, Ivano, you got it wrong and I didn't. Suck it.
Forget you. At least I'm not short.
What does that have to do with anything?
Man, this book is getting really heavy.
Ivano, what's going on? Hello?
Arvo, why is there 2 Oompa Loompas standing in front of me?
That makes no sense. I'm going to act fast. Remember, think fast and do the following.
First, face. Ask the person to smile. Does one side of the face droop?
Ivano, can you smile for me?
I'll try.
That's only half a smile.
Second, arms. Ask the person to raise both arms. Does one arm drift downward, or is one arm unable to raise up?
Oh, Ivano, raise both of your arms for me. Oh my God, there is one drifting downward.
Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange?
Ivano, repeat this simple phrase. Arva is the best.
Arva's the worst.
That's strange and slurred.
Time. If you observe any of these signs, call 911 immediately.
Hold on, Ivano. Hello?
This is 911. What's your emergency?
My friend's having a stroke.
Okay, ma'am. Calm down. What is your location?
I'm at the Conjure residence. It's the big house in the middle of nowhere.
Okay, ma'am. We frequent that house a lot. I'll send a dispatch right away.
Okay, thank you. Ivano, stay with me. Help is coming soon.
Several lifestyle changes can greatly reduce the risk of having a stroke. Reduce salt intake. High blood pressure is one of the leading causes of stroke. Cutting back on salt is one of the most significant steps to maintaining or lowering blood pressure to a healthy level. Eat a heart-healthy diet. Maintaining a healthy balance between your good cholesterol and bad cholesterol is the best way to prevent high cholesterol, heart disease, and an increased risk of having a stroke. Stop smoking. Smoking is not only bad for your lungs, but your brain as well. A smoker is at twice the risk of having a stroke because smoking damages blood vessels, raises blood pressure, and speeds up the clogging of arteries. Exercise. Obesity increases your risk for high cholesterol, high blood pressure, diabetes, and stroke. Extra weight places an added strain on your entire circulatory system, but aerobic exercise helps reduce stroke risk.
First, face. Ask the person to smile. Does one side of their face droop?
Okay, I can't look at him.
First, face. Ask the person to smile. Does one side of their face droop?
Ivano, can you smile for me?
I'll try.
This